of an introduction, as she's well known with our residency program. This year, she's one of the 2 administrative chief residents, and the administrative chief resident who has been in charge of many things, among which the schedule of grand rounds throughout the entire year. She's done a fantastic job. She's done a fantastic job also on other accounts, in counseling residents and being supportive of the residency and being supportive of the entire Department of Surgery. Like many administrative chief residents prior to her, she has contributed and enriched our residency program. I'd like to mention, for instance, the idea of the photo of the week, the image of the week that she introduced a couple of months ago, and many other things that she's done for our residency. And among the other things, it was a conversation that we had a few months ago to start a historical lecture. And I'm not sure that this is the first historical lecture of this department, but certainly it is a historical lecture, and Barry will tell you more what this may lead to. So without any further fanfare, I'm going to ask Barry to come down here to the podium and tell us about this historical lecture series, and prior to her talking about Louis Atteberry Stimpson, the first chair of surgery in this department. Barry, thank you very much.
Thank you very much. Okay. Thank you very much, Dr. McGlassie. That was a very kind introduction. So this morning I have the honor of giving, maybe not the very first, but the first in a series of annual historical grand round lectures. So our plan is that from here on in, each year we will be hosting a grand rounds discussing each of the 9 chairmen of the Department of Surgery throughout its 116-year history. And this will coincide in about 4 years in 2018 with the 120th anniversary of the Department of Surgery, for which that time we'll have discussed all of the chairmen, and we will have a celebration at that time celebrating the 120th anniversary of our department. So in light of this, I've had the pleasure to learn all about the very first chairman of surgery here at Cornell, and that was Louis Atteberry Stimpson, and I'll be sharing with you some of the amazing details about his life. So this is Louis Atteberry Stimpson, and as I said, he served as the first chairman and professor of surgery at Cornell University Medical College for nearly 2 decades, from its founding in 1898 until his death in 1917. During his tenure, he had a profound impact on advancing the field of surgery in the United States, in addition to the medical education and healthcare delivery here at Cornell. He was born in August of 1944 in Paterson, New Jersey. He was a very gifted student who was accepted and attended Yale University when he was only 15 years old. He graduated with honors in 1863 at the age of 18. He then joined the Army after graduating from Yale and served as a captain and an aide-de-camp to 2 generals in the Civil War. This is the actual letter that informed Stimpson of his appointment as aide-de-camp. It is dated April 21st, 1865, and signed by the Secretary of War of the United States, Edward Stanton. This was on behalf of the President of the United States, President Andrew Jackson, who of note had only been president for 6 days, as Lincoln was assassinated 6 days prior to the signature on this letter, April 15th, 1865. He was recognized for his dedicated service to his country by being elected Companion at Large of the first class of the Military Order of the Loyal Legion of the United States. This was a very prestigious honor. These documents shown here are the original paperwork related to his nomination for the selective award. In a paper Stimpson wrote about his Civil War experiences, he stated, "An unexpected volley had brought down a number of men. The doctors were hurried up, improvised operating tables, and set about their work. It was, though I did not know it, the beginning of my surgical career, for I asked a doctor why he was going to amputate an arm from which the back of the elbow had been shot away. 'Why do you not leave it as it?' I asked. 'The arm is still good, and I think he could get well of his smash as well as he could of an amputation.' He snorted with scorn, and off came the limb. 'Nowadays, we should certainly save it. and I still think it might have been done then. It is amazing how his words foreshadowed his future prominence and pioneering advances in the field of trauma and orthopedic surgery. In 1866, he married Candace Wheeler in the American Embassy in Paris. They had 2 children, Henry Louis Stimpson and Candace Catherine Stimpson. His son Henry went on to serve in key leadership positions with 4 US presidents, becoming Secretary of State under President Hoover, and he served as Secretary of War under Presidents Taft, Roosevelt, and Truman. Stimson did not actually take up the study of medicine until he was 27 years old. He initially went into banking with his father and became a member of the New York Stock Exchange in 1867, and this is a photo of the New York Stock Exchange around that time. However, his wife fell ill, which, in addition to his prior interest, motivated him to pursue a career in medicine. He moved back to France with his family in 1871 to attend the medical school of Paris. While studying medicine in Paris, Stimson formed an important friendship and studied under Louis Pasteur, whose germ theory would deeply influence his own surgical career. He finished his medical education back in New York at Bellevue Hospital Medical College and earned his MD degree in 1875. This is one of his many original notebooks from medical school. And here you can see his meticulous attention to detail with some of his anatomy drawings, including the abdomen and thorax in the upper 2 pictures, the bladder in the left lower picture, and the chest wall in the lower right. This is a photograph of the exterior of the Medical School of Paris in the mid-19th century when he was in attendance. In a letter to his brother in 1872 while at medical school, he wrote about his experience there. He stated, "I have had very much been pleased with the Paris School of Medicine. The professors impress me as being men of great ability, and the students are all quite old. Very few boys among them, and a very serious business-like air pervading the whole place. The teachers are quite thoughtful, and most of them very thorough. All are able, in fact, I can't see how it can be otherwise. They are the sifting of all of France." He went on in the same letter to describe a competition he had observed for candidates vying for an assistant professorship at the Paris School of Medicine. He describes it as such: "A subject is announced. Candidates are allowed 12 days to write a thesis on it. These theses are published, and each candidate in turn has to answer the objections which his rivals make on his piece. This is done publicly and orally, no warning having been given to the nature of the objections. The jury is composed of 7 professors in crimson gowns and hats. When the contestants got excited and both talked at the same time, one of the professors rapped on the table and made them stop. Considering all circumstances, I don't see how the man in the box kept himself from flying at the persecutor's throat. Talk about bull baiting. That is the way they get their professorships here." This illustration depicts an amphitheater in Paris School of Medicine in the 19th century, similar to where we are today, with what looks like a description of this competition that Stimson describes. Stimson also developed a very close relationship with Dr. Joseph Lister, who was world-renowned for his groundbreaking demonstration of sterilization and surgery throughout Europe. Stimson observed a surgery of Lister's operating in a carbolic acid mist and based a prize-winning essay on this procedure in 1875 entitled "Bacteria and Their Influence Upon the Origin and Development of Septic Complications of Wounds." His relationship with both Doctors Pasteur and Lister had a very strong influence on him and the remainder of his surgical career. The following year, he joined the staff at New York Hospital. It was here that he took what he saw with Dr. Lister and demonstrated the first antiseptic operation in the United States in 1876. This truly was an amazing feat, as he embarked on this undertaking only 2 years after graduating med school and very shortly after a new appointment as faculty at New York Hospital. This also coincided with the untimely passing of his wife earlier that year. He performed an amputation of the leg for a large tumor of the knee, utilizing the rules of Lister. He described his procedure thoroughly in his casebook, stating, "Before the operation, sponges and instruments had been soaked in a carbolic acid solution. During the operation, a constant play of carbolic acid spray, solution 1 in 20, was kept directed upon the operator's hands. When from any cause the spray was intermitted, a cloth or protected, saturated with carbolic acid, was placed over the wound. Bleeding vessels were ligated with antiseptic catgut ligature, which had also been prepared by suspending them for 1 week in an emulsion of oil and carbolic acid. Contrary to custom, the wound was closed. The anterior and posterior flaps were closed over a drain, and the flaps were brought together by fine silk sutures, prepared also by soaking in carbolic acid solution. This is a depiction of the carbolic acid spray apparatus designed by Dr. Robert F. Wire. This apparatus, however, was no longer used by the late 1880s due to the damaging effect of carbolic acid on tissues. This is a photograph of surgeons actually using this carbolic acid spray apparatus during surgery. You could see it continuously being sprayed on the surgeon's hands without gloves for sterilization during surgery. In an excerpt from a letter to his brother, he describes his excitement about the successful procedure. "My operation came off last Tuesday and was quite a success," he stated. "I used the antiseptic method of Professor Lister of Edinburgh in all its details, and that brought quite the crowd, 50 to 75 people. The operation went off smoothly, and the man has been doing marvelously well. The whole wound, except half an inch where the drainage tube lay, united within 48 hours, and there has not yet been a drop of pus, not a tenth of a degree of fever. At this rate, he will be entirely well in 10 days, which is quick for an amputation of the thigh high up. Still, I must not holler before I am out of the woods, and although we have escaped all of the early complications, some of the later ones may step in and spoil the affair." On postoperative day 12, he documented that his amputee was doing quite well, sitting up today, and he was hoping to have him walking on crutches on Monday, a fortnight after the operation. He is now nearly as well as another patient whose leg was taken off 2 months ago. A week later, he goes on to state to his brother that his patient has made a brilliant recovery and he was very grateful. He states this antiseptic method was used for the first time in all of its details in a capital case in the city and perhaps even the country. After another week, as you can see in his handwritten account, he states to his brother, "But don't make too much of it. It is not great shakes." He was a very humble man, and this is an example of his modesty. But what he failed to mention was before he brought antiseptic surgery to the United States, 80% of all wounds suffered from gangrene, primary union of tissue never occurred, compound fracture equaled amputation, and mortality for major operations was 1 in 3. This is a photograph of Dr. D. Bryson Delavan, who eventually became an esteemed ENT surgeon. He was actually the house staff who assisted Dr. Stimson during this very noteworthy amputation. One of his quotes I felt definitively illustrated the effect this case had on the evolution of surgery in the United States. Dr. Delavan stated, "There, visibly demonstrated before us, was the triumphant proof that gone forever was the old regime of surgical uncleanliness, infection, and death." Stimson continued his influential career at New York Hospital, noted to be an expert in critical care, general surgery, and orthopedic surgery. In terms of his orthopedic successes, he was famous for his contribution to fractures and dislocations. He introduced the molded plastic splint and developed confined traction for femur fractures. He also advanced new methods of reducing dislocations of the hip and shoulder. He spent a good portion of his surgical career tending to those less fortunate than himself in the hospital wards at Bellevue Hospital and the House of Relief Hospital, both depicted here on this slide. The House of Relief Hospital served as an emergency hospital in Lower Manhattan, established by the Board of Governors of the New York Hospital. The Board of Governors wanted this new House of Relief Hospital to be a model hospital for emergency cases with 3 distinct functions: to provide emergency treatment for patients who could not, to provide emergency treatment for accident and sunstroke cases, to dispense medicine free of charge, and to provide treatment for patients who could not be sent away to their homes or to other hospitals. Dr. Stimson actually designed the surgical rooms himself, heavily influenced by antisepsis. Other esteemed doctors who worked at this hospital included Dr. Lewis Connor and Dr. William Halstead. It is recorded that during this time at the House of Relief, from 1894 to 1905, there were 14,500 fractures recorded. Stimson published many articles in various prestigious medical journals, which underscored his wide rate of interest within the field of surgery. It is documented that he has published over 130 articles and 10 book and book chapters from 1844 to 1917. Here you can see an article he authored on IV saline injections in conditions of severe shock, and another regarding peristaltic action of arteries. He discussed cancer of the rectum, the use of ligature in the treatment of aneurysms, in addition to intestinal obstruction. He discussed the technique of operations for the relief of appendicitis. In this article, he had a strong focus on infection control. He discusses the importance of sponge counts, preoperative washing of the abdomen by several hours of contact with a layer of green soap, followed by a dressing of compresses wet with bichloride solution. Moreover, he states the abdomen in the OR should be shaved, scrubbed with soap and water, prepared with alcohol or ether, and then with another bichloride solution. Regarding perforated appendicitis, he states if the appendix is unrecognizable because it is embedded and forms the wall of an abscess, one should not attempt to remove it, but to solely evacuate and drain the abscess. He warns of protecting the neighboring intestines during drainage of the abscess, and even recommends transrectal drainage of deep pelvic abscesses. He published on trauma, here on gunshot wounds to the abdomen. He was ahead of his time. Here we can see he even created his very own version of our ECOMP, documenting the results and methods of surgical operations at the New York Hospital from 1895 to 1896. He meticulously documented each case, even categorizing the wound by wound classification. He kept track of all mortalities. Here you can see they performed 17 inguinal hernias in that year, 2 of which were strangulated. 1 died due to the operation, and the other died independent of the operation. Here you can see they even performed 1 laparotomy for tubercular peritonitis, 1 for generalized sarcoma. There were also 2 apparent operative traumas that year of the abdomen, 1 of a gunshot wound to the belly and 1 to a stab wound. They performed 20 appendectomies with 1 mortality. Interestingly, he also published about the ever-relevant topic of self-restraint in the practice of surgery. He authored 2 classic and widely used textbooks, Operative Surgery and Fractures and Dislocations. He was a member of many prestigious surgical societies. In 1879, he co-founded the New York Surgical Society with his colleague, Dr. William Van Buren. At that time, there were only about 30 surgeons practicing in New York at 9 large general hospitals and 3 active medical schools. Stimson and Van Buren organized the founding meeting in October of 1879 with 7 other New York surgeons, including McBurney, Keyes, and Wire. He was also an active member of the French Society of Surgery, an honor accorded to very few surgeons outside of France. Additionally, he served as vice president of the New York Academy of Medicine from 1893 to 1896, and he was a regent of the state of New York from 1893 to 1904. In addition to all of these outstanding clinical accomplishments, one of the most important achievements, especially for all of us sitting here today, was his instrumental role in establishing the Cornell University Medical College and its affiliation with New York Hospital. In 1898, Stimson persuaded his close friend, Colonel Oliver Hazard Payne, to donate $1.5 million to establishing the Cornell University Medical College as one of the leading academic medical schools in New York City. He was deemed one of the founders of Cornell University Medical College and was named the first chair of surgery in 1898 and remained as such until his death in 1917. Medical progress in an educational institution under university auspices was the idea that Stimson had in mind. His main objective was medical research, which he correctly divined could best be developed in a teaching institution under university control. This is a photo of the medical college in 1898 down on First Avenue and 28th Street. I'm sorry, it's coming out a little blurry here. In recognition of his many contributions to medical education, Cornell University erected a new building named Stimpson Hall in 1903 up on its Ithaca campus for the teaching of anatomy and physiology to its undergraduate students. This is a current picture of Stimpson Hall up in Ithaca today. At the dedication of Stimpson Hall in 1903, Stimson himself gave the keynote address entitled Teaching and Research, Distinct and Indispensable Functions of a University. He traced with great discernment the conditions under which successful teaching and genuine research can be conducted. He concerned himself with the development of all of the departments of the medical school, and he was particularly devoted to the interests of the laboratory departments. During his tenure at chair, he led the charge to significantly raise the academic standards for admission to Cornell Medical School. For the first time, medical students were required to have a college degree for admission to medical school. Stimson wrote of the challenges initially caused by the unprecedented change in the academic requirements. In a letter dated September 29, 1908, he stated, "This year at the college is required a college degree for matriculants, and thus far only 2 students have registered. What a lot of teaching they will get. We hope to get 10. I had hoped initially for 20 or 30. Today, Weill Cornell Medical College graduates approximately 100 medical students each year." In 1912, Stimson, along with George Baker Sr., a governor and benefactor of the New York Hospital, led the way toward the creation of a new medical center when Cornell University Medical College and the Society of the New York Hospital signed an affiliation agreement in 1912. He had the foresight to envision the many benefits that this synergistic relationship would engender, meeting the rigorous academic training needs of the medical students, as well as providing vitally needed medical and surgical care to the hospital's patients. In a letter to his older brother, Reverend Henry Stimson, on August 10, 1912, about the proposed affiliation with the New York Hospital, Stimson reported, "My New York Hospital plan seems likely to work out. Rives approved of it and is working for it among his colleagues. I have submitted a proposal which 6 of them have already accepted in principle and practically in detail. And I think they are so eager to get a hold of the money that it can probably be stiff in my requirements." This was the start of a long-standing, mutually beneficial relationship between Cornell and the New York Hospital that still thrives today. In addition to being a dedicated clinician and educator, Stimson had a lifelong passion for sailing. He was a member of the New York Yacht Club and owned a famous 80-foot schooner yacht, the Fleur de Lis. He sailed in the Kaiser's Gold Cup race in 1905 with his daughter Candace, who often sailed with him, and she was the only woman in that race. Each summer, he was known to cruise around Europe on this yacht and with his daughter Candace, sometimes accompanied by his colleagues Dr. Edward Keyes and Colonel Payne. Stimson died unexpectedly on September 17, 1917, of a sudden heart attack while walking his dog at his home in Shinnecock Hills, Long Island. At the time of his death, he was still making important contributions to the field of medicine, as he was working on a book on military surgery, with a special focus on treating shell shock, trench disease, and antiseptic irrigation of wounds. In 1944, his daughter Candace endowed the Louis A. Stimson Professorship of Surgery in honor of her father. This professorship is currently held today by our current chairman, Dr. Fabrizio Michelasi. Dr. Edward L. Keyes, a Yale classmate, friend, and professor of urology at the Cornell University Medical College, said in a memorial service for Stimson that he manifested the possession of that well-known asset that has been called the hand of steel in a glove of velvet. The minutes from a meeting of the faculty at Cornell University Medical College after Stimson had passed away effectively reflected on his life and his influence at Cornell. In the passing of this truly great man, Cornell University loses a distinguished teacher, a wise counselor, a loyal friend. Medicine loses one of its most commanding figures, and the community a public-spirited and patriotic citizen. In a letter dated March 13, 1879, Stimson commented reflectively, "After all, there is little in life except the satisfaction of doing good work and doing it well. There is nothing so satisfying to horse or man as functioning well." Clearly, by Stimson's own measurement, he certainly achieved a meaningful life. His rich legacy still lives on today, as evidenced by the cutting-edge surgical advances being developed in the Department of Surgery at New York Presbyterian Weill Cornell Medical Center. Thank you very much, especially to those who have helped me with this presentation, including, of course, Dr. Michelasi, Karen Zippern, and the medical archives here at New York Presbyterian. Lastly, I'd like to thank Dr. Stimson himself for his inspiring career, his visionary leadership in both the clinical realm and medical education. Thank you.
Thank you very much. This was absolutely fantastic. To hear how much Dr. Stimson really contributed to surgery and obviously to our medical center. And he did a fantastic job really compensating on his achievements over the course of his life. Are there questions for Dr. Friedman?
Not a question, but just a couple of other interesting things about Stimson. The first medical school for women in this city was developed by the New York Infirmary in about 1870. great advances, his work in antisepsis was ignored for several decades.
Mhm.
4 years after his first operation with carbolic acid, James Garfield was shot. And I don't know how many of you know about James Garfield, but he lingered for about 80 days. He died a miserable death. And he probably died of sepsis introduced by all the physicians and surgeons who came to see him. And had they been familiar with Stimpson's work or paid attention to it, Garfield most likely would have survived. So.
Thank you.
Thanks. Dr. Gallagher?
We have a beautiful painting on the 7th floor by the elevators that is no longer there. Isn't it of, it's of Dr. Stimson. Is it, where is it? Is it being restored?
I don't know.
Who stole it? What happened? That corridor will be renovated soon, and so that painting was moved into the chairman's conference, where we have actually 4 additional paintings of previous chairs. Stimpson being the first, Gibson the second one, Howard the third one, and then the 4th one as well. And after the 4th one, we go to Dr. Shires, who happened to be the 7th. So we have all the chairs there for the time being, because the corridor will be renovated. Nobody has told. Any other questions? Well, again, thank you very much. This was a fantastic start to this historical series. We hope to gather all these lectures eventually into a publication at the time of the 120th anniversary of our department.
Thank you.
Thank you very much. This was good.
Great.
It was fantastic.
Great.
All right.